My name is Paige Bunk, and I'm here today with Soon, and we are going to be talking about organ and tissue donation transplantation. So, can you tell me how you got involved with this organization?
I joined the organization about 8 months ago.
Okay.
I was looking to do something more meaningful with my career. I have a background in sales and marketing and a little bit of event planning. So to find a job in that niche, I was looking for something, something more rewarding. And then a friend of mine had mentioned that the Sharing Network was in New Providence, which is close to where I live in Westfield. I'd never heard of it. I had no idea it existed. But I looked it up, and there was a job description that fit my background, which was hospital services manager. And I applied not knowing the depth of what I would be getting into. But from there, I interviewed, luckily got the position, and I haven't looked back since. It's been amazing.
Yeah. What's been your favorite part about working here?
Every day is different. You can go to bed thinking, oh, tomorrow I'm going to go here, I'm going to do this, I have this plan, and then you wake up and it's a totally different ballgame. You're sent to a different hospital, or there's a case, or there's something that you have to troubleshoot. It really just varies day to day, and I love that. I feel so invigorated every day. Working at a desk job, it's great. It can be fulfilling for some people, but this, literally, you are on fire almost every day.
Yeah. On an everyday basis, what do you mostly do or work with?
So in hospital services, we're really tasked as being the experts in the donation process. We are assigned a set of hospitals, and it's our job to maintain relationships there, do education. We have donor councils that we run to create a culture of donation awareness in the hospital to get people excited about organ and tissue donation. But really, it's a lot of relationship management. If there is an issue, we are supposed to know who we can gather to help troubleshoot those issues in that hospital, to get that conversation going, to hopefully, get the process moving in the way that we would like to see it go, but as a collaborative team approach.
Yeah.
A lot of the time, it really is, it's difficult. It can be difficult because if you're taking over a new hospital, or if it is a very tough situation that you're in, you want to be mindful. This is their hospital. We are guests in their facility. We want to do our best to be respectful, but also do our best to maintain the donation option.
Yeah. How much did you know about organ and tissue donation before you started the job?
Oh, zero. But you learn quickly, and everyone's a great teacher. The hospital services department, we are so close as a team. We know that there's coverage. We know if there's a question, we're just a text or a phone call away. Senior leadership here is literally just a phone call away. Everyone, if they don't pick up the phone right away, they'll call you back within a short period of time. You never feel alone. So the learning curve was steep, but it went quick. And you're always learning day to day. There's always new issues. Even, our supervisors are like, oh, well, this is one of the first times we're tackling something like this. Let's figure it out together. Very much as a team approach. And even though we are alone in our hospital sometimes, you're never feeling alone.
Yeah.
Which is great.
Yeah. So how many families or people have you met after working here?
In the very short time I've worked here, I've had the privilege of working on many, many donation cases so far. In my hospitals, I want to say, let's say an average so far, 20 cases, and I've been in various levels of the process. Sometimes if I'm at another hospital and I come in later in the case, I'm doing a lot of the wrap-up and the follow-up with the staff, letting them know outcomes, getting feedback from them of ways that we can improve, sharing with them feedback that we think could improve on our end. Sometimes if you're there from the beginning, you're doing the initial on-site evaluation on a patient, which can also be very interesting because it's more clinical and you're trying to get the initial picture and report that back here to the staff. So it's been varying levels.
Yeah. What's been your favorite part of working here and your least favorite part of working here? Or the more difficult parts?
Yeah. So my favorite part of working here, I have to say, is the fulfillment I get from the job.
Yeah.
So I like to say that the highs are very high. And when you have that high, you really do go home feeling very happy and full that day. I don't really know how to describe it. It's rewarding is also a word that I would describe it, but it's hard to put into words, that feeling, because I've never had that feeling before working here, but it's hard to describe. And when the most challenging thing is, it can be very emotional because we get invested in these families. They become part of our being for however many days this case can go on. And depending on the case and your personal experience, it's hard not to relate it to yourself. I'm a mother. I have a 4-year-old son. When I'm on a pediatric case, it's hard not to think about my son and take that home with me. So that can be a challenging aspect. But we share, we debrief with each other, we lean on each other for support. So that is something that I utilize all the time to get me through.
Yeah. What did you used to do before working here?
I did sales and marketing. I worked for an organization most recently that did networking events for residents and fellows.
Mm-hmm.
So within the healthcare field, working with physicians, but in a totally different way, much more superficial than this. I mean, helping them come out of training and find their first position is very important, but this is a very much more in-depth clinical aspect of it.
Yeah.
You said you work in local hospitals?
I do. Right now I'm covering, my biggest hospital is Robert Wood Johnson, New Brunswick, and then a few more within that, RWJ Barnabas Family, and then outside of that, some of the Hackensack Meridian hospitals.
And you guys go all the way through New Jersey?
We cover hospitals in the 14 northern counties of New Jersey, so that's 55 hospitals. The very southern tip of New Jersey is covered by another organ procurement organization, but we cover 55 of those facilities.
I work in the University Hospital in Plainsboro,
Oh.
Princeton.
No, nice. Very nice.
Yes. I guess you have to have a presence in all of them, right?
We do.
Yeah.
And our clinical coordinators come in and out, depending on who's on shift, who's available. They need to have a face, somebody that they can go to for issues, someone that they know that will be there for them, who they can rely on as their contact. Otherwise, they're chasing after whoever ghost that comes in and out, facilitating the whole process and then leaving after the case has been completed. Even during one case, there can be several coordinators coming in and out depending on the length of the case. So having a hospital services manager dedicated to that facility, they at least know this is my contact. This is my first step into the sharing network. Let's start here. We're just one phone call away.
Yeah. So after you started working here, have you gotten involved with any of the ways that they raise awareness through like the walks or anything like that?
Yes. So we are all involved in the walks. Especially with being a hospital services manager, we promote these walks to the hospitals themselves, because a lot of them want to have teams in honor of donors that they had in their unit. So we're there with them, walking with them, being involved, promoting it. Also, I've been involved with, just recently been involved with the shawls program that we have here that's run by Jillian, which is an amazing program. I don't knit, but I cross stitch. So I'm very interested in that kind of thing. And she's been working to get me trained on how to knit, which is, I haven't done it yet, but once I finish my first one, I'm sure it'll be very fulfilling.
Yeah.
But in those kinds of ways, we try to do what we can because we're always out of the office. Hospital services managers, we're really only here maybe once a week to do paperwork. Otherwise, we're out in the field. So it's hard to get involved in the office culture sometimes. We have a minority awareness week coming up in August. And we're doing a few things here in the office. And if we're here, it would be great to attend the potluck and do all of those things. But sometimes it's a little difficult.
Yeah. Do you want to tell us a little bit about the shawls and like how that whole thing works?
Yeah. So Jillian Padilla, she runs the program. She's one of our clinical assistants. But essentially, we have a team of volunteers that come in and on their spare time at home, they hand knit crochet shawls. We give them to grieving donor families. But at the 2-year mark, we ship it to them. And it's just another way that they remember that their loved one is not forgotten and they're in our hearts. And it can be quite healing, just so they know. A lot of the families that we work with, they struggle because they don't want their loved one to be forgotten.
Yeah.
So we do anything and everything in our power to make sure that that is not the case. We have their names etched in the hallways here. We have our quilt squares, which we take to the communities, and I've taken them to several hospitals. And just having people look at them and remember that their loved one meant something to them is a huge ordeal. So those shawls really do provide that comfort. And a lot of the families that I've spoken to, they arrive at a time when they really need it. It's almost, I don't want to say fate, but something like that, where they get this package and that they're not expecting it, and it arrives at the right time that they needed it. So that means a lot.
Do you have any personal connection with this at all?
I don't have a personal connection with donation. My mother is on dialysis. She lives in Korea. They moved back to Korea when I graduated from college. And then she went to end-stage renal failure, and she's on dialysis now. She's been on dialysis for about 6 years, and she's on the transplant list in Korea. But that would be, I guess, my connection to donation.
Yeah. What would you say to someone who wouldn't be sure if they want to sign up as an organ donor after working here and, knowing all these people and meeting all these people that have gone through this?
That's an incredible question. It's hard because you can, in the time when you're involved with a family, it's always tragic and it's unexpected and very emotional. So you can understand where they're coming from and how they struggle in that time, not knowing what their loved one wanted if they weren't registered, or if they were registered and they never knew. The thing we share constantly is if you register to be a donor, share those wishes with your loved ones.
Yeah.
So they know exactly where you stand. it's hard to say that everyone should. I obviously believe that everyone should be a registered donor,
Mhm.
but it's hard to, if people have personal experiences and you don't want to take that away from them. What I always share is the facts. Organ donation saves lives. One organ donor can save up to 8 lives.
Yeah.
One tissue donor can impact 50 to 75 people. It's just a fact. And if you are in that rare, less than 1% of all deaths that can actually do that, why would you not want to do that?
Yeah.
Leave that legacy for your family, for your children. All I can do really is share facts. Everyone's emotional and personal situation is so different. So if I share something about my mother, that may not impact someone as much as if I share just the facts.
Yeah.
It really just does speak for itself. And I feel like it makes a big impact. When we're educating residents and fellows and the nurses and physicians in the hospitals, once they realize, they hear that less than 1% statistic, they're blown away,
Mhm.
no
Yeah.
matter what, because they just don't understand it. And that, I think, makes a huge impact alone.
Yeah. How has your life changed since you started working and getting involved?
It's gotten a lot more unpredictable. It's gotten a lot crazier, but I think a lot better. It sounds cliche and it sounds crazy, but I do feel like sometimes I'm saving lives by doing what I do.
Yeah,
Maybe I'm not
yeah.
actually doing the surgery and in the OR actually doing recovery, but I do feel like I'm playing a part in the process.
Yeah.
And it is an important part the more and more I do it. So many people just don't know the facts and the process. And healthcare professionals are not taught this.
Yeah.
So the fact that a chief of surgery or some, attending intensivist will listen to me for 2 minutes about this process it's incredible.
Yeah.
And I feel like I'm making a difference.
Yeah.
And
Yeah.
maybe not immediately, but a step in the future, at least in education, making sure that donation happens moving forward, making sure the process is running smoothly, hopefully moving forward.
Mhm.
But that has been the biggest impact
Yeah.
on me.
Do you talk to your friends and family or anyone you meet about it and try and spread awareness a lot?
I do. So it's weird because now I feel like I have a lot less tolerance for other people's work angst
Yeah.
at their little jobs. And I also had that work angst too. Oh, my boss is so annoying. I can't believe it. Oh, this customer gave me such a hard time. And now it's really, when they have those issues, I'm like, really? Really?
Yeah.
But I do talk about it a lot. And maybe I talk about it too much. Maybe they're kind of sick of hearing about organ donation and the impact that it can have. But I don't think so. I think that they're actually happy for me.
Yeah.
My
Yeah.
husband says it all the time. He says, you're more tired than I've ever seen you, but I can tell you're more fulfilled by the way you talk about it. Just when the highs are high, the lows are low. But he's like, even when you talk about the lows, it's a more meaningful low, not just,
Yeah.
Mhm.
It's more, you wish you could have done something better, or you wish this process went better, or you're thinking about how you can make improvement. And he's like, that is invaluable to us. And, for him too, he's had to chip in more since my hours are more unpredictable. Before I was doing pickup and drop off all the time. And he's totally supportive. He's like, I will
Yeah.
do whatever it takes. He's like, this seems to be your calling.
Mhm.
Yeah.
Thank you so
Yeah, well,
much.
thank you
Yeah,
so
no,
much for
thank
coming
you.
in.
No, I
We
appreciate
really
it.
hope that the way that you're involved inspires more people to get involved with it or spread more awareness about it. So thank you so much for coming in.
No,
today.
thank you for having me. This was a lovely conversation.
Yeah.
Thank you.
Thank you.